Sleep Awareness Week, the American Medical Association says about 30 million Americans have sleep apnea, but only about 6 million have actually been diagnosed, and it can cause a ripple effect of medical issues, including some as simple as fatigue and heartburn, but it can also increase your risk of high blood pressure and lead to some other major health conditions. So joining us today, Dr. Katherine Green. She's the medical director of the Sleep Center at the University of Colorado Hospital. Thank you so much for coming in.
Thank you for having me.
This is such a common problem. You know, we're all so tired, and I think sometimes we think it's just because we're not sleeping enough, but there might be a medical reason for it.
That's absolutely right. You know, there's a lot of reasons that people are tired these days, and so it's easy to write off exhaustion as, you know, doing too much, running yourself ragged, but sleep apnea is one of the leading causes of not getting the quality of sleep that we need at night.
So what should we be looking for? What are some of the signs and symptoms?
Yeah, it's a great question, and it's actually a really wide variety of things depending on the person. You know, I think a lot of people classically think of sleep apnea as snoring and pauses in breathing at night, and sometimes those are the first things that may kind of alert a bed partner that something may be wrong. Many people with sleep apnea may not have those symptoms, or it may not be obvious. Some people just find that they don't feel their sleep is refreshing, restorative. So you're tired during the day, you wake up with brain fogs or have morning headaches that you can't really explain. For some people, it's as little as mood changes or energy changes.
Makes sense. All right, so if I think I have it,
yes,
what do I need to do?
Yeah, so sleep testing is getting easier and easier, so there's no excuses anymore for not being tested. I tell my patients and I tell my family members, if you feel like your sleep quality is not what you want it to be, or if you're worried about any of these signs, the way that we test for sleep apnea now is mostly by home testing. So it's a little monitor that you pick up from our sleep lab. You basically take it home and sleep with it for the night. It monitors your breathing and your patterns of sleep and your oxygen levels, and is the best way for us to see, is there a problem with breathing that's affecting your sleep quality at night?
So it's not inconvenient anymore.
No, there's no excuses, right? Yeah. We used to have people put it off because it was too hard to do.
So I think the other thing a lot of people think about is, if I'm diagnosed, am I going to have to breathe with one of those giant CPAP machines?
Yeah, the CPAP machine. So, you know, everyone has a mental picture of what a CPAP looks like. And I talk to people all the time who say, the only reason I haven't gone to get testing is because I don't want one of those. And while that may be true, it's no longer a good excuse not to get tested. CPAP is still the single best thing we have to treat sleep apnea, and for a lot of patients, it is a life-changing therapy. But we have a really wide variety of things that we can do to make sleep apnea better, ranging from surgeries to devices that you can wear in your mouth at home at night. And so I think that the testing is the first step, and knowing that the treatment options are really varied, the benefit that you get from a better night of sleep is well worth exploring all of the options.
It's going to be unbelievable. So if somebody doesn't treat this,
yeah,
we kind of talked about some of the risks, but what are they?
Yeah, so again, very wide reaching. So for a long time, we've known that sleep apnea is really pretty directly linked to putting additional strain on the heart at night while you sleep. So we know that it increases your risk of things like high blood pressure and even strokes and heart attacks long-term if left untreated. What we're really increasingly aware of is the effects on the brain and cognition as well. So untreated severe sleep apnea has now been associated with things like Alzheimer's disease, cognitive impairment while we age. We know that there's an increased incidence of workplace accidents and motor vehicle accidents, so driving safety is a big thing. So lots of effects that we don't want to ignore.
All kinds of effects, dangerous sounding stuff. Thank you so much for coming in. We appreciate it. If you need help, if your partner is saying you're snoring and not breathing at night, get in and get yourself tested.